finally got to old people.
I mean, I gotta show her now. I didn't realize that down, but.
Hi, Mavis. Nice to see you in person.
My gosh, you look young still from pictures and stuff like that.
See everybody with their drinks and no masks?
Yeah,
I
good.
knew I needed glasses.
No, anyway. I know. I saw that.
That's true. Rock and roll.
We're talking about how J&J is not as effective against the Delta variant. So, more details. Yeah,
And take a closer
but
look at
it's okay.
Yeah.
I'll give you 13.
Oh, no, you can go. It's time.
Okay. All right, we're gonna get ready. Sorry. It's okay. Oh, Vern's got a lot to talk about.
Always.
All right, the time being now 9:01 a.m. on Wednesday, July 21st, 2021. I'd like to call this meeting to order of the Public Health Committee of Kane County. I am Committee Chair Jared Sanchez. Clerk, could you please call the roll?
Silva. Lewis. Shepro.
Pepro here.
Strathman.
Strathman here.
Tippy.
Pepe here.
Wallace.
Wallace here.
Sanchez.
Here.
Hurog.
Okay, approval of the minutes. Actually, we can get a consensus on this. Do I have consensus to approve the minutes of June 16th, 2021?
Request unanimous consent to approve.
Do I need a second on that, Mr. Shepro?
No,
Okay, that's
just no objection.
all right.
Without objection, it could be so ordered.
So we'll move on to public comments, agenda, non-agenda items. I don't see anyone online, it looks like. I don't see anyone present here from the public, so we will go to finance and budget. Are there any questions about this month's public health financial reports? Okay. Animal control. Do we
Good
have
morning,
Brett?
everyone. How are you today?
Good, how you
Yes,
doing?
I'm here. Very good. I'll keep mine short. I know we have a lot to get to. Revenue exceeded expenses, which is always what we're looking for. Other than that, the only thing to really report is that in August 28th is our next low-cost vaccine clinic. People are still hesitant going to their vets receiving. So our revenue, we're projecting to be just a little short this year, but we're going to be completely fine. I just always like to keep you guys abreast of what's going on. But again, promoting that low-cost vaccine clinic, if everybody could promote it in their districts, that would be amazing and greatly appreciated. If anybody has questions, I'm always here. Please let me know.
All right, thank you, Brett. Are there any questions for animal control? We'll move on. Executive Director.
Thank you, everyone.
Thank you, Brett. Kathy, you want to take over?
Okay. All right. So last month I had said there was a survey that went out and only 2 responded. So we're going to send it out again. That's what our data and quality coordinator told me. So I'll make sure she sends it out again. I can't remember exactly who responded to, but I don't want to, we'll send it out again. I don't know if everybody got it, but so we'll send it out again. And that survey was about how we want information presented here or updates, things like that. So I'll send that out again. We have a few presentations today, small ones, and then a couple of resolutions. So our first one is going to be by Julie Weigel. She is our Assistant Director for Environmental Health, who works under Uche Anwuncha, our Director of Health Protection. And she is going to give you an overview of environmental health program today. So with that, I will let Julie get going.
Thank you. Good morning. As Kathy said, I'm going to just provide you some general information.
Is your mic on? Some of these are also quiet if they are on.
It's on.
You might have to bring it closer too.
To actually get real close to.
Okay. Is that better? Okay. I'm sorry.
That is.
I'm going to give you an overview of the different programs and services that environmental health in Kane County offers. So just some of the general things we're going to talk about today are food permits, inspections, Plan reviews, complaints and outbreaks, septic permits and inspections and complaints, our water well program, which includes permitting and complaints, our non-community well program, our water vending machine inspections, our tanning program, our West Nile virus program, our indoor air quality information we provide, and our property maintenance programs. We're going to start off with kind of how our inspectors work. Most of the work that we do is required by state and local ordinances. Most of our inspectors' time is spent out in the field, about 85%, and then the remaining 15% is spent in the office. The general work that we do helps provide oversight and technical resources to our well and septic contractors and to our food establishments, and then we provide general information to the public. All of our inspectors are highly trained. Everyone has a minimum of a Bachelor of Science or Applied Science if they have enough science hours outside of that. And every year they're required to get hours in food, well, and septic training. And everyone is required after 1 to 3 years to become a licensed inspector as well with the state. Our food establishments, we have 4 categories of establishments. We start off with our high risk, which are our category 1s, which are our full service restaurants. We break those out just because the number or the time it takes to inspect like a large grocery store is so much longer than a Chili's type establishment. So for fee purposes, we break those out. Those establishments are inspected 2 to 3 times per year. Then we have our medium risk, which are places where they make the food just as you order it. They're not making it ahead and then cooling it down, which are things like McDonald's, Subways. Those are inspected 1 to 2 times per year. And then our low risk are bars, convenience stores, places with prepackaged food, and we inspect those 1 time per year. We have approximately 1,850 establishments. That number is always fluctuating. Things that we look for in food establishments, when we get a new application in, we review their plans for proper construction. When a business changes ownership, we always go in and do a change of owner inspection. That way, if there's something that was permitted, 15 years ago that may not be in compliance any longer, we can work with the new establishment to bring that up to code. We permit all of our establishments to make sure that they get the correct number of inspections and are providing safe food to the public. If we have an establishment that's going to be demoed or maybe go from a furniture store to a restaurant, we also look at the well and septic system, if they're connected to those systems, or if it's demoed that they're properly abandoned. We also go into food establishments if there's smoke or fire damage, water, sometimes, an ANSEL system is accidentally set off, that will go in and help the establishment work through cleaning that up and what they need to do. As I said, when a new establishment comes in, we always review the new plan. So we look at the equipment that they're using to make sure it's all approved, their plumbing plans, the copy of their menu to make sure that they're going to have enough refrigerators or hot or cold holding to meet their menu needs. We look at ventilation, things like that. We work very closely with the municipal building departments and also the fire department on those. And then once the construction is complete, we go in and we do an opening inspection where we look at structural items, make sure everything that they did meets the plan that they submitted. And then 30 days after the establishment opens, we go back in and make sure that everything is functioning as it should be. I know you can't really see this, but this is what the establishment inspection form looks like. It's the FDA food code. So it's universal throughout the state now. So every county in the state is using this form. And we've recently moved to a digital version through CityView KPass. So our inspectors are now doing this on their computers in the field. Just a quick list of things that we look for when we're doing inspections. So we're looking for proper temperatures, cleanliness and sanitation, employee health, that people aren't coming to work ill, they have proper hand washing, and that they have good sewage disposal. So there's just some pictures of violations. You have to have access to your hand sink, that the chicken's out of temperature, and obviously those are some very dirty deep fryers. Other things that we do where we are on call, we go out and if there's a fire at a restaurant at midnight, we're notified of it, and staff from our office will go out and inspect the damage, see what food might need to be disposed of, any cleaning that they need to do. and if possible, get the establishment open back up as soon as they're in compliance. And we also have, our staff goes out on evenings and weekends to do temporary food events. We have roughly 55, it fluctuates as well, especially with COVID, but we do approximately 500 temporary permits or inspections per year as well. Next, we'll do a quick discussion of septic. So when anybody is building a new house or renovating, or if their existing septic is just no longer functioning, they turn in a plan, we review it to make sure it meets all code requirements. And then we have our inspector goes out when they're installing it, when it's in the ground, but still open so that we can see it. We do an inspection, and if the contractor had to make any slight changes, we request a new plan be submitted so that we have the correct record in our office. And if there is a septic tank that needs to be abandoned, they just submit proof that they've had it pumped and crushed so that it does not hold water essentially and can't fall in. Very similar process for wells and well ceilings. We get in the paperwork, we review it, and then an inspector goes out to inspect either the well being sealed or the well. We go out for well drillings a couple of times per year per contractor, and then we go out and inspect the water lines for each installation. We also help the public by providing a list of contractors in the area that are licensed. Other things that the well and septic program does is we investigate failing septic systems. So the picture on the left is the failing septic system that it's the black ooze that people see and definitely smell when we get complaints. We review soil reports to help people if they're looking at buying a lot and want to know, approximately what type of system would need to go on it so they can figure out some cost. We review soil reports for that. We do approval letters for construction of outbuildings or patios, things like that. In an average year, we do about 55 well inspections, approximately 62 well ceilings, and 70 septic inspections. Non-community wells are the well systems that are bigger than your private well, but smaller than your public water supply. So they're kind of those in between. So churches, schools, things like that. So the inspections we do for that, which are every other year, we locate the well, the pressure tank. We look for sources of contamination. We are checking for good construction. Sometimes they get hit by a lawnmower and get cracks, things like that. So those are what we're looking for. We take a sample and submit it to the state for testing. And then if the sample is satisfactory, we let them know that everything is good and that they're not required to test for another year. If it's bad, then we let them know and they have to do repeat samples or do disinfection, whatever's necessary to bring their well up into compliance. We also do the same type of thing for water vending machines that you see at your grocery stores. So we check the machines to make sure they're clean. We collect a water sample, we fill out paperwork and notify them if we get any bad samples. Property maintenance complaints, the development building department has been helping us with these right now with COVID, but in general, we go out if we get a complaint on junk vehicles, garbage, open burning, harborage of pests, noxious weeds. We do an inspection and then send a letter letting the property owner know what they need to do to come into compliance with the county code. And then we follow up to make sure that the nuisance has been abated. If it has not been abated, then we will typically send a second letter or, depending on the violation, issue a notice to appear at the county's administrative adjudication. Just some quick photos of what types of complaints we go out on. So Canadian thistle, the junk, the garbage, burning complaints, and insect and rodent harborage.
What's Canadian thistle?
It's considered an Illinois noxious weed. So you're required to eradicate it from your property if you have it growing. There's a big list of actually noxious weeds that are not allowed.
Which one was that?
That was Canadian thistle.
I found a great big buckthorn tree in my backyard. I was wondering where all that buckthorn was growing and I found one in my backyard.
Yeah, there is a big full list and I can't tell you everything that's on it. But if it's considered an Illinois noxious weed and we go out to your property and it's on there, we would send you a letter telling you that you need to. Most people will just mow it. Although some people, if they have a natural prairie area or something like that, will go through and, individually remove the noxious weeds.
sure I have some of that.
It's everywhere. Almost everyone does. Our staff also conducts tanning inspections for our permitted tanning facilities. They are basically, when we get those, we go out and we review tanning logs to make sure that people are only tanning one time in 24 hours. We check their sanitizer that they clean the beds with. We check the overall establishment for cleanliness. We also verify that that the establishment is requiring any patrons to use proper protective eyewear before tanning. We also check the bulbs in the bed, because if an establishment puts in the wrong bulbs, people can get horribly burned from tanning beds. So we check the bulbs and make sure that those are in compliance. And that's probably the number one thing that we find is the wrong bulbs, or they're the correct bulbs, but they're a different manufacturer and they just don't have the paperwork to prove it to us. So sometimes they have to call and get the sheets to prove to us that they are the correct bulbs. And then we're just verify their proper paperwork so that they train their staff when they replace their bulbs and things like that. West Nile virus, something that we're currently working on. Basically, we have a surveillance network where we collect and test mosquitoes and birds from May through generally October. It's the first hard frost is when we wrap up our program. We respond to homeowner complaints and treat mosquito breeding sites. We provide assistance to municipal and township programs. We provide larvicide to many of our municipalities and townships at no cost to help them do larval control of mosquitoes. And we also educate the public on personal protection and elimination of mosquito breeding sites on their property.
Ask a question, please.
Absolutely.
So what kind of using insecticides to stop the mosquitoes? Are those mostly environmentally approved, or what kind do you
Yes,
use?
they're all approved by the EPA. There's multiple different brands. Currently, we're using Naturalar. It's a product that they drop them, they're briquettes that they drop into predominantly catch basins and other small areas of standing water where the Culex mosquito likes to breed.
Okay.
And it prevents them from hatching out and becoming mosquitoes. Stops them at the larval stage, which is the best time to do it. And then just some other things that Environmental Health does. Our radon program, we provide technical assistance to homeowners on the health effects and radon mitigation. And we also do sell radon test kits in our office for people who'd like to come in and purchase them to test their homes for radon. Mold, there's not a lot of code on it, but we do offer technical assistance on health effects and the proper way to remove mold for individuals in the county. Ceremonial fire permits, which are basically the fires that are the big fires, the bigger than 3 by 3 by 3, those actually require a permit for the unincorporated portions of the county. And the homeowner, if they're having that, just also needs to let the local fire department know that they're going to have it. And then you can only burn brush. And we also do tick identification. So if someone pulls a tick off themselves or their pet, they can bring it to us and we will ID it for them to let them know. We don't test it, but we can ID it. And if for some reason we can't ID it, we will send it to the state for further assistance on the identification.
Do they test those for Lyme disease? Do they test?
We
that?
don't, but if it is the type of tick that would carry Lyme disease and the person wanted to do something with it, we would let them know that what type of tick it was so that at least they'd know it's the type that carries Lyme disease.
Anything else, Ms. Bates? I just wanted to get your name on the record so people listening know who you are.
Oh, Mavis Bates. I'm just amazed. This is quite a list. Thank you.
Mr. Tepe?
Good morning. Thank you very much. You mentioned earlier that when it's under construction or it's being rebuilt, that you go through a restaurant or a grocery store and make sure that it's up to standards.
Yes.
Who sets those standards?
We follow the FDA code, which has basic code requirements, and then there's some that set out through IDPH. Basically, IDPH adopted the FDA food code, and then there's some special carve-outs for plumbing and things like that.
So you're inspecting for state standards?
Yes.
Okay, so there's no standards that have been approved by the board or something of that nature? No separate standards that the county has or enforces?
If they're building code things, then yes, but as far as the food part, no.
Okay. And then what are the fees associated with these kinds of inspections or with these kinds of organizations?
Well, there's a plan review fee and then there's the actual inspection fees. And I have to be honest and tell you, it's a very long list that it's broken out by category. I can't tell you all of them off the top of my head, but the plan review fees range, I think, between about $600 and $1,000 for the plan review. And then the inspection fees are based on the type of establishment. And those range, I think there's in the 900s down to in the 500s.
I'd only be concerned that our fees are covering our costs.
Yes, and our fees automatically go up by the cost of living every year for the food program. So every year, whatever the cost of living is automatically added to our food permit fees.
Thank you. Very informative.
You're very welcome.
Madam Chair?
Thank you. I don't know if you'll be able to answer this or if Ms. Foster will be able to answer this. We have 2,350 food inspections going out annually. If we have 1,850 permanent food locations and 500 temporary food inspections, what is our staff ratio to that?
We have when we're fully staffed, we have 9 full-time inspectors. And then we have an Elgin supervisor, Aurora supervisor, and myself. And then we have an administrative assistant.
Is that adequate? Is that standard adequate?
No,
We could always use more help. Yes.
currently we have 7. So even at this
Microphone.
time we're not fully staffed as of now. We still have 2 inspectors positions that we have to fill. So no, we're not adequately staffed.
So that would be 11. Is that adequate?
7. So
We currently have 7 inspectors. When we were full staffed, it would be 9, but no, we really need at least a 10th person, possibly an 11th. We haven't added, our establishments have continued to grow, but we haven't added inspectors for many years.
Okay. Okay. Thank you. That's good to know.
Are there any other questions? Mr. Brown?
Yeah, thank you. This one?
Sometimes you got to get right on them.
Yeah, I don't know. I got a question for you. I had a phone call the other day from a resident that thinks their
I don't think that one's working at all, really.
thinks their neighbor's septic is not working properly, that there's this black ooze, as you mentioned, coming out of the ground. I was going to call the county health department or the county development department on this, but this would go to you instead?
Yes, I would.
Okay, I wasn't aware of that. So maybe I'll give you the address after the meeting
That would
here
be
today.
great.
Okay, and then the weed control also, I wasn't aware that that would go through the health department as well.
Right now, the development department's assisting us with complaints on property because of COVID. So that could go to the development department, but if you give me the information, I can enter it in and it'll go directly to them.
Okay, I don't have one on that. I just
Okay.
was surprised over.
Yeah, normally before
presentation.
COVID, we split it where we did the north end of the county and the development department did the south end of the county. So we kind of divided up the property maintenance.
Okay,
But because of COVID, they've been taking the whole county to help us out.
thank you. It was a great presentation.
Thank you.
I do have one question. All of these functions that we do, are they mandated by state law that we do them, or are they just things that we've identified as a need in the community to keep track of?
The vast majority are required.
Thank you.
There is actually a Canada Thistle Act. I think it's called Canada Thistles and Other Noxious Weeds.
Thank you, Counselor Shepro. Okay. Thank you, Julie, for giving that wonderful presentation, showing us all the things that the health department is doing that we wouldn't normally be aware of. So thank you for being here.
If I could just make a comment to Mr. Shepro's comments. Mr. Shepro, you are an encyclopedia brainchild. Either that or you're very good with Google.
No,
or both.
I remember because my father's old Illinois revised statutes before they recodified. There was a chapter called Canada Thistles and Other Noxious Weeds, which I just thought was a great name for a section of the statute book. And I didn't know what a Canada Thistle was, but I thought it was impressive that it got its own chapter.
Indeed, thank you.
All right, moving on. Ms. Foster, what is next?
Okay, I don't see the agenda, but I wanted to.
Oh, we have the update on COVID-19.
Okay, so that would be the next one. We could jump them around. I see Michael's is on. Sure, if we go out of order, that's not a big deal, right? Because I thought the
No, it's fine.
COVID-19 and then there's the marketing one.
Yeah,
right?
that's the order.
Okay, so we'll just, it's okay. To make it easier for IT, we'll just do the next presentation. So we're going to skip to the presentation for update on Health Department marketing campaign, which Michael will do. And then following then, Uche will do the COVID-19 update.
Okay.
Thank you.
Mr. Isaacson.
All right, great. Thank you. Good morning, everyone. So just going to share a few slides about some of the marketing efforts that we've been doing to try to encourage people to get vaccinated here over the last 6 months or so, or almost 7 months now, 7.5 months. So we entered into an agreement with Tag Communications and have been working very closely with that group and our IT department to develop materials and push them out to a variety of audiences out in the community. So one area where we have a big focus is on print and digital. So we have developed a large number of flyers that we're using. So currently, and maybe Ms. Onwuda will touch on this, but we're working with Great America. So we have a template that we're using for all of our clinics that we're doing in the community, where we are giving away Great America tickets to youth who are getting vaccinated. We also have other posters and flyers that have been put together in English and Spanish. One thing that we have found in our conversations with the community through focus groups and just talking to people who come into our clinics is that really talking about the myths is a big thing. So people have these conceptions in their minds about what may be wrong with the vaccine. And most of them are pretty easy to prove that they're not true. So you'll notice on the copy of the flyer over on the right-hand side, we have some bulleted items there about them being safe, effective, free. We do hear people who are worried about their DNA being altered. That's not something that happens when people get the vaccine. It doesn't give people the virus, and it doesn't, we don't have any evidence that there's any worry about infertility with these vaccines. And then also on our Spanish language flyers, we touch on other issues around immigration and really want to make it clear we're not checking IDs for people. Our goal is to get as many people vaccinated as possible. So people do not need to worry about their immigration status. We're not deporting people who come to our vaccine clinics. Anyone who's in our community, we want them to be vaccinated. So we really want to make sure to get that message out. We also have been continually updating our website. So we developed the canvax.org site to make it easier for people to register. And we received a lot of positive comments about that. This is a screenshot of our main Kane Health website. So this is something that again, we work with our IT department and Tag Communications to develop content. So we try to make it as simple and to make it a one-stop shop for people to be able to show up at the site and find where vaccines are being offered in the community. And the good news is that right now you can walk outside and you're practically within a stone's throw of somebody who's providing vaccines. So there's a list and maps and all kinds of things that people can use here. So that's been a good resource. We've also been putting a lot of effort into both radio ads and our social media campaigns. So we did finish a 2-month run on 95.9 The River, where we're fortunate to have a couple of U.S. veterans who live in Kane County who talked about their experience getting the vaccine and why they really spoke to how it is a form of patriotism to really step forward and get the vaccine to protect those around you. And then on our social media, there's just a couple of snippets there. We like to keep people updated in terms of how we're making progress, which you'll see with Uche's presentation. We're making fantastic progress. But again, we also are focusing on different myths. So we're refuting those with facts, and you'll see they mirror some of the others that were on the print item. So we have been running on Facebook paid media campaign to reach specific segments of our population to get this information to them. Also, we've spoken before about the videos that we've been running. These have been very powerful, and we've received really tremendous feedback from people on these. These are all Kane County residents talking about their personal experiences. We have a lot of different people who've stepped forward to participate in these videos. So it could be people representing the different demographics that we have here in Kane County, people representing the business community, people representing veterans, people representing organizations that are actively working to try to engage people to get vaccinated. And again, many of these are available in Spanish with native Spanish speakers as well. So these are all on our YouTube channel. And we have about 30 videos that are posted right now. And we're just getting ready to film some more with more of a focus on school as we get close to the fall to make sure we're getting that information out to people. So if you have any other ideas that you'd like to share with us for people who may be good to have in a video, I think that the company we're working with has been doing a fantastic job putting these together. And then our newest bit of outreach that I'm really excited about is thanks to PACE. They have been donating space to us to put up posters promoting vaccine. So we have just put up, we do have to pay for the development and the printing, so it's not completely free, but PACE is donating the space to us. So we have put up ads at bus shelters in Aurora, Carpentersville, and Elgin. So here's just 3 samples of the sites. And then on the next slide here, you can see a couple of examples of that artwork that we're using. So it's English and Spanish, really focused on the benefit that resonates more with a person. So not so much focused on the health, but really focusing on the fact that by getting all of us vaccinated, that's what's really allowing us to get back together with our family. So you can see it's time to gather on the left, and time to celebrate on the right, which of course was much harder to do, and with social isolation and keeping people apart over the past year, that's been really hard. So with more people getting vaccinated, it's been really fantastic to get people together. So we've been having great luck with this. As I said, we are one of the highest, the counties with the highest vaccine rates in the state of Illinois. And Illinois is doing pretty well. Yes.
Yes.
Thanks to, and our staff has been doing a fantastic job running these clinics. So it's really been a huge effort with not only the county staff, but also with community partners that we've been working with. But I don't know if anybody has any questions about our outreach efforts. Yes, ma'am.
I'm just curious how the vax site at the fair went. Was it successful?
Ms. Strathman, just wanted your name. to be
I'm
on the
sorry,
record.
Cheryl Stratham with the question.
Sure.
At the fair, I noticed there were county health people there giving shots, and I just
Absolutely.
wondered.
I imagine that'll be in the next presentation.
Okay,
Yep.
Yeah, it went really well.
good.
Mr. Tepe?
Yeah, Tepe here. One of my observations at the fair was that there were about 4 times as many people there staffing the shot clinic than there were coming and getting shots. And it's really disturbing that more people aren't taking advantage of this. But at the same time, we probably need to start taking a look at coming down with more minimal staffing so we can reduce the overall cost associated with making this happen. Is there any way you can just send a few people out and do things like this? You know, how big is the team that you send out to do a minor shot clinic?
Okay, so I believe at those, we also had National Guard.
Yeah, there were a lot of them there.
Yeah, so we're kind of sunsetting that now that we, but the resource was there, and, the state wanted us to use it, but I believe we're,
I didn't mean to
sunsetting
be
that.
critical about what happened, by just an observation saying going forward, that people just aren't stepping forward and getting their shots, and it's disturbing. So
Yeah, with the county fair, it's a large event with a lot of people. So you anticipate that you might have more people And we were vaccinating inside, and then we had a table outside. So, we had people working at the table and those who were helping with the vaccination. But it's really difficult to anticipate how many people will get vaccinated in a county fair. But with other community events, we usually have fewer people. And like Kathy said, it's, we have the National Guard helping us, so they give us a lot of staffing. So,
But at the same time, I want to be very, very clear. I think the efforts to go to fishing derbies and things of that nature are quite commendable. It's really great for you to be innovative about going to those kind of smaller groups, because I think that makes everybody feel more comfortable, and they certainly can't say that we're not trying to serve the people. So,
Mr. Chairman, question and comment?
And if I may, the National Guard, we should feel honored that they have stayed here, because in other communities, they have gone and they no longer support. It's because of the work that the board and the health department has done that they have stayed with us for this period of time. So they come in a group, they travel in a group. It is the National Guard team. So that, and in one way, to me, it's celebratory, the fact that the Guard is here supporting Kane County, to see that there's no fear with the Guard, because that was certainly a fear factor that we had previously with uniforms. But now they're one of us. They're part of our family, and I personally take great pride that they have remained with us for this long.
It's like a
Mr.
win-win
Chairman,
situation.
comments?
Mr. Shepro.
I've been, the last week or so, there seem to have been all kinds of new statistics and stories that many of the southern states, the virus is increasing substantially. Southern Illinois, several counties have had large increases, and I gather that overseas, many countries are still in deep distress. And I guess I'm wondering how much we want to stand down if we have to bring it all back, because we don't have a wall around the county or the state. And what our health department experts feel is basically on the horizon. Everything I see now is that maybe people are getting, what was the term in the stock market, irrationally exuberant about this all being behind us. And I wonder, with all the strains that are developing and the talk about needing booster shots, how wise it is to, break everything down and turn it off.
Well, I certainly can't comment on that.
yeah.
I
We'll
guess
follow
that's kind of a question for maybe Michael and Kathy, is are we equipped to ramp up rapidly again, should the situation dictate?
I'll let Uche speak to that as she leads our contact tracing efforts and mitigation.
Yeah, thank you, Mr. Shepro, for that question. Yes, it is a concern. If you remember, about this time last year, in the summer, the numbers went down, and then, it seemed like people were keeping their guards down, and then, it goes back up. Yes, we're hearing what's going on around the country, and the fact that our vaccination rate, total vaccination, is about almost 49% at this time. We're still not fully vaccinated, and not anywhere, CDC would not even pin down a certain percentage for herd immunity. So, and we're not anywhere close to what they were thinking. So at this point, I think it's foolhardy for people to, not follow proper precautions because we're still in this pandemic. It's not over yet. So yes, we can quickly ramp up and ramp down, and we've put in place some measures to make sure that, with numbers going up, we can ramp up staffing and then, or down as the case may be.
It really seems as despite all of the creative efforts to extend the vaccinations to the groups that have been resisting it, is that we seem to have sort of hit a wall and haven't made a lot of progress with the people who don't want it for whatever reason. And I guess that's a concern to me. I mean, we can't make people take it, but I had a question that came up when I was at the hospital last week. And when I went in for my appointment, they asked me the standard questions, do you have any COVID symptoms, coughing, etc. And I said at the end, you didn't ask me if I'd been vaccinated. And they said that Delnor, they said, we're not allowed to ask you if you've been vaccinated. And I found that to be baffling because all sorts of, and they claimed it was HIPAA, and all sorts of agencies and employers and everything are asking their people if they've been vaccinated. And actually, when I told that to my doctor, he was surprised at that answer too. But I got it from 2 or 3 different people there, and I wondered if you could perhaps explain that, or what is the answer to that?
The hospitals
You
have,
can't speak obviously to Delmar's policy,
right.
but they weren't saying it was their policy. They were saying they weren't allowed to ask.
Yeah, I can't comment on what their policy is and what they've decided to do, but what I can say is whether you're vaccinated or not, the measures are still the same. The mitigation measures are still the same for COVID, for vaccinated and unvaccinated people in the hospital. So.
Yes. Thank you.
Ms. Bates?
This is not about marketing exactly. It's
Well, let's keep it to marketing now while it's still on the table, and then we'll move on to the COVID-19 update.
Thank you.
Anyone have any questions about our marketing efforts? Madam Chair.
I would like to know what future plans are going to be for our schools. I believe that Pfizer is going to be hopefully getting approved for vaccine for 2 to 11 in the fall, I think September, maybe a potential month that they're going to be able to launch this pending approval. It does concern me that our students are not going to be fully vaccinated. We've seen what's going on now with the Olympics, when our athletes the Olympics may be paused because of the increase of COVID spread. St. Charles has recently, I think as of yesterday, per their school board, has said that they're not going to have a mandated mask policy. It concerns me because of the spread of our teenagers and then into the elementary school children as well. So is there plans for a marketing outreach to our parents to shift from adults to children and to young people who hopefully will lead the way to support vaccination?
I know that's been discussed.
Yeah, we have been doing social media ads really focused on youth and getting them vaccinated. And then we've had some very successful, and I don't know if it'll be touched on today, but some very successful school-based clinics. And as you mentioned, as more vaccine becomes available for the younger ages, we anticipate a big uptick. Also, when there's full FDA approval, that's something that people are saying is a concern for them, for their children, and sometimes for adults too. So when that comes, we also anticipate that'll open the door for some people to get over some of their concerns.
All right. Thank you, everyone, for your questions. I think that's it, right? Okay, thank you for updating us on the marketing efforts, Michael. Next is the COVID-19 report, and Uche is going to be delivering that today.
Good morning. So this is some of the information I've already given, but starting with the cases. So the chart on the, I don't know if you can pull down the Zoom.
Pull the little.
So looking at, we started this program in August, and you can see the spikes that we had earlier in December, and then we had another one in January, and then March, April. So we came really down. This is the lowest we've been since the pandemic began. And we're now inching slightly up. If you can see the 11th, the 14th, 15th, towards the end, is that so we're inching a little bit up. On the right-hand side, I have in the last 11 consecutive days, we've had slight increases. However, we're still under the threshold. So we're doing well, even though we have to be cautious. Test positivity rate is going slightly up. We're at 2.2% at this time. And regarding the ICU beds, again, we're above the threshold, but you can see that it's trending down. We're seeing increases in patients hospitalized for COVID-19. So, there's concern, we're really low, but we have to keep an eye open because definitely we're seeing a little trending up. In terms of vaccination, we're 48.98%. We're almost at 49%. And Madam Chair, I know you want that 50%. We're getting there. Yes. So currently we have 261,000 people fully vaccinated in King County. I put in this slide here looking at one dose vaccination by age group. So total population, 60% of King County population has received at least one dose. For the 12 plus population, we are at 71.2%, so we're doing really well. Adult population, almost 74%. And, look at the 65 plus, we're at 90% for first dose. So this is great. So I know that, oh my goodness, what happened to my, I know that people are concerned about the variants. Not sure what happened to
Click
that.
down, maybe it'll pop up.
Oh, click again. No.
Nope.
Okay. So the B1, the orange one is the B1617, and that's the Delta variant. Right now, as of this slide is as of July 3rd, and definitely things have changed. So at that time, B117 was at 35%. That has gone down considerably. Looking at the region, HHS Region 5, which includes Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. With the variants, we're not testing everybody that's positive for COVID-19. It's a sampling of the population. So not very accurate at the county level. That's why the one I showed you before was Illinois, the variants in Illinois. This is more current as of July 17th, and that's the bar with the double asterisk on top. You can see that right now, the Delta variant is overwhelming. at almost 80%. So the problem, the Delta variant is a problem in the community. It's something that we have to keep an eye on. From what CDC says, it's still, the vaccine is still good against the Delta variant. However, it's the 2 doses, not the 1 dose. So I think that's the last slide I have. Yeah. Questions?
Anyone have any questions? Ms. Bates?
Thank you, Mavis Bates. On the radio today, they were talking about that there's the breakthrough infections for people who are fully vaccinated. And, we all remember the stories that Pfizer and Moderna were 95% effective. Now they're saying that with the Delta variant, they're 88% effective. So my question is, are we seeing more breakthrough cases in Aurora, Kane County? And should we be bringing back our masks? I see you always wear a mask, Kathy, but you've relinquished that right now, but.
Okay, so I can start with the last question regarding the mask. I was on a CDC call on Monday, and the question was asked, and they still said that right now, fully vaccinated people do not need to wear masks. Yes. So that guidance hasn't changed yet. So, we trust the CDC guidance, and that's what we follow. So until that changes, our recommendation is still for those who are not fully vaccinated to wear masks and social distance. And, the people who are vaccinated do not have to wear masks. But, if you feel comfortable wearing masks, there's nothing wrong with that. I was in an event in Arizona. I had my mask on because it was an indoor event and it was packed. So, if you're in an indoor event that's packed, you might want to put your mask on.
Okay. Thank you.
And then the question about the breakthrough cases, we're 95% with Pfizer and Moderna, so we anticipate that we will have breakthrough cases. So the percentage of the breakthrough cases are not beyond what we're seeing. I think there was some report that vaccination, hospitalization for people who were vaccinated was 0.00023%.
That's pretty.
So, exactly. So that's what we anticipate, and that's what we're seeing. So we're strongly encouraging vaccination.
Okay, thank you.
Gums, I have a question.
Gums, go ahead.
Are we finding that our testing is substantially down?
Yes.
Okay. So we're really not sure how much is out there because people aren't being tested.
Right.
Thank you.
Mr. Brown.
Thank you, Brown here. Could you explain, up until COVID, it was recommended that people get a flu vaccine shot every fall. Could you explain a little bit, maybe, is that still necessary? Is it not necessary? And if it is necessary, I'm just wondering if it would be possible, since we still have got the Kane Vac site open, if it would be possible if the health department offered that vaccine there as well.
That's a great question. We absolutely recommend a flu vaccination because, the symptoms for flu are not very different from the symptoms for COVID, and you don't want to confuse one for the other. So, one less thing to worry about, at least take care of the flu vaccination. We're considering many options for flu vaccinations, and we haven't made a decision yet on, whether, because I think, I don't know how long our lease is till November. So yeah, we're still considering where to offer those flu shots at. That's certainly a good idea.
Yeah, it seems like it would be a good idea if we could do that. It would, again, promote the use of the, the VAC site
Mhm.
and maybe get the word out even more that the site is there for that use.
Right. Absolutely. I forgot to mention, I didn't put a slide in for the community vaccination sites. We're doing really well with the school vaccinations. Anywhere that we have youth, we're offering Six Flags Great America tickets, and we're getting a lot of interest in it. Even when we didn't offer Six Flags, with the youth, with the school vaccination sites, we had upwards of, I think at Larkin, the last one was 289 shots that we had 2 weeks ago. So, and we have several other events. Right now, as of today, we have an event at ECC, a vaccination event at ECC that's open to the public. San Filippo Fish and Nuts office in Elgin, we're vaccinating on Friday. And I think we have one on Saturday, Champions Arena in Aurora, Family Focus in Aurora. So we're taking any suggestion of location where we think that, the farmers markets, the fishing derby was very successful. Champions Arena was a soccer competition in Aurora. We administered a lot of vaccine doses there. So yes, for the youth, as parents, suddenly realizing that school is starting, they are understanding that, the safety of their children is important and they're vaccinating. So anywhere that we can get children 12 and up, we're vaccinating.
Mr. Chairman?
Quickly, please.
Bates, have you thought about First Fridays in Aurora? That's a gathering.
Yeah, I talked to the city about it. It looks like the VNA is
Oh.
vaccinating at that.
That's where I got my shots. Good.
Madam Chair.
And I'd like just to tag on to what Uche has said. And I talked to Mike Isaacson. So this is just a plea, if anybody in the public is listening, or to any of our board members. Sometimes if we bring a celebrity in, whether that be a musician that would appeal to our youth, a sports figure who would appeal to our youth, and have them either present a demonstration or a small mini concert, would be helpful to bring a group in. We have the parking lot of the Batavia Vac site. We also have the Vac site itself, which is a large facility. We could comfortably bring in a couple hundred people in there, as we have done previously, to get them vaccinated, to listen to some little concert, maybe even just a 15-minute concert, or if there's a soccer star or a baseball star, or football, that somebody may know. I'm sure that we would welcome that individual with open arms, and we could turn them over to Michael and his team and present it. Anything we can do to get young people together with their families to get vaccinated would be a great cause of celebration here in Kane County. So I'm putting up a call for help. So thank you.
All right, we have a couple of other things to get to, so we need to move on. If you have any questions for the health department, just email them. And if you want to share the answers next month, that would be welcome. So the first is a resolution authorizing personnel replacement hiring for a community health specialist, environmental health practitioner. Can I get a motion and a second to approve this resolution?
Strathman moves.
Strathman moves.
Silva seconds.
Silva seconds. Do you have any comments that you want to add to this?
This is just to fill somebody who resigned. So it's in the head count.
Mr. Tepe?
Yes, Tepe here. A couple questions. One is how many open positions do we have? And two, is the challenge or part of the challenge in filling open positions, the compensation that we offer.
That is true because we've had an environmental health practitioner open for a while, the other one, right, Julie? And we have sent out a lot of advertisements, but we have not got the applications, right? So,
That's correct. We've gotten very few applicants, and the few that we have didn't meet the qualifications.
yeah, so,
Yeah, the pay is really low for environmental health practitioner that has a license. We're paying them $19 an hour.
A little over $19 an hour.
So we can't even, we tried to put the information at, I think it was UIC, just before I sent in the email. Another county had a similar position for much higher. Obviously, there was no need to even advertise there because it was much higher than what we had to pay.
How
So
much higher?
So how many positions do you have open? Roughly.
oh, in the whole department or that I'd have to get you in health protection. We just have, what is it, 3?
yeah, we have,
I mean, would it be 5, 10? I'm not trying to put you on the spot,
Yeah.
but
And I have,
point being, if compensation is part of it, it's something that should be looked at.
least for this position, we have 2 open.
Thank you.
Ms. Bates, quickly.
How much higher, Bates, how much higher were the other counties paying?
I don't remember, was it, you remember what the, like,
I don't know on an hourly rate specifically, but I've seen postings for similar positions that are in the very high 30s to low 40s, and at $18.50 to $19.50 at 35 hours, we're significantly lower than that.
35,000.
35 hours, okay.
8 years of a property tax levy freeze, and we see the effects in the health department not getting these increases to keep up with the times. So we'll have to
1,000
figure out
cuts.
how to make amends for that. Okay, we're good on conversation, discussion on this one. Can we please have the roll?
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman, Strathman, yes.
Seppi,
Seppi, yes.
Wallace,
Wallace, yes.
Silva.
Silva, yes.
Yes. Okay, resolution passes. The next one, authorization to enter in an agreement with Jeskulka Turman Strategic Communications for our FY22 Immunization Coverage Levels Grant Program. Can I get a motion and a second to pass this, to discuss and pass this?
So moved. Silva moves.
Silva moves.
Strathman, second.
Strathman seconds. This is a company we've used before and had great results with them. And this is just a kind of housekeeping to continue our contracts with them. Any quick questions?
Yeah, Mr.
Tempe.
Chairman. This is for 22. This is a company that we're doing business with now. They're now doing, this is an extension of what they're doing?
Yes.
Yes, this is entering into the last year of a grant we have with the state of Illinois, and the purpose of this is for the marketing. So that's the intent for most of this grant. It also supports some of our staff time that's working on this project, but this will allow us to complete this grant. And again, it's for a 7-county area, so it's a bigger geographic project.
Thank you.
Okay, clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman, Strathman, yes.
Seppi,
Seppi, yes.
Wallace,
Wallace, yes.
Silva.
Silva, yes.
Inches.
Resolution passes. We have nothing under old business. Reports placed on file. Can I get a consensus to place the reports on file? Do we
I
have
ask
consensus?
unanimous consent to place reports on file, Mr. Chairman.
You have unanimous consent. No need for executive session and no new business. Can I have a motion and a second to adjourn?
I move we adjourn.
Strathman,
Seppi.
seconds.
Motions, Strathman seconds. All those in favor say aye.
Aye.
We are adjourned. Thank you for being here.